Welcome to Ready Camp, June 24th, 2019, Wausau, Wisconsin. Let's check it out.
COPD or other like respiratory issues, or if they're in respiratory distress, they're having trouble breathing, then we can apply it to them to help. There's like different pressures and how much oxygen is actually going to be put through the mask that you can change depending on how well they're breathing. So when your patient initially comes into the ambulance, you're going to take their vitals. Those are things like respirations, blood pressure, pulse ox, things like that. Pulse ox is like one of the things we're going to check the most. So your pulse ox should be about above 94. So if it's below 94, then you start to worry about if they're getting enough oxygen and doing enough breathing. Respirations is another thing that we look at for that. So you'll take an initial set of vitals. Then when you notice that their vitals are not where you want them to be, you'll apply the C-PAP machine, and then you'll take another set of vitals within 5 minutes usually. And then if their pulse oximeter is rising and it looks better, then you can just keep the C-PAP machine going as it is until you arrive at the hospital, while checking vitals every 5 minutes to make sure they're not decompensating. If they begin to decompensate, which means their vitals are dropping, then you can choose to raise the amount of oxygen that is being put through the C-PAP machine and check their vitals again. So it's just a constant checking of vitals and changing the oxygen as needed. So when you, this is what the C-PAP machine looks like. This attaches to the oxygen tank. This mask is what's applied. I can do it. So you'll have them sitting, obviously. This is the mask that's applied to their face. Don't worry, we'll clean it every time in between if you want to try it. So this part goes on the bridge of their nose, and this is also a nebulizer. So if you choose to give them something, like if you have asthma, you probably have an inhaler. That inhaler probably is albuterol. That's what I use, at least, if you have asthma. And that will be put directly into the nebulizer, and as oxygen is going through, you can turn it on and off to allow the treatment to go in as well as they're receiving oxygen. So if we were to turn it on, we would turn it on. Tell them, when you apply this to their face, it can be very scary. So that's what it sounds like, and it can be scary to the patient to have this oxygen blowing in their face, especially little kids. It can have a feeling of claustrophobic feeling to them. So you want to make sure that you're guiding them through the entire process and telling them what's happening. You'll use the idea it's going to feel like you're walking through a wind tunnel or you're in a wind tunnel, and then you'll tell them, I'm going to apply it to your face, and I want you to hold it for me. So then they'll hold it to their face and then let the oxygen run for a little bit so they get used to the feeling of the oxygen being put into their body, and then you'll attach the mask to the back. So I'm going to have you hold it to your face.
Now we've been practicing, so they're already used to securing the mask on there right away. So.
Do you feel air coming out, or does it feel good? Feels good? This one? So sometimes when you apply it, the air will leak out of these areas around their cheeks. So you'll want to ask them, do you feel air escaping or feel air coming in? Because when you have the mask on, you can feel where air is leaving, and the better suction that you have, the more oxygen that they will receive. So then you will keep it applied to their face until you get to the hospital, obviously checking those vitals.
Why don't you open your mouth while you're doing the C-PAP?
I don't know.
So the air is being forced in, whether it's through the nose or the mouth. So usually if somebody's actually having difficulty breathing, they probably will be breathing more through their mouth. But they will see improvement within a minute or two. And then they will, it's going to force the air in, whether it's through the nose or the mouth. So it really does a good job either way. So.
The harder part is almost breathing out because you're pushing against everything. So you got to really focus on taking a deep breath and and get it all out.
And it's important when like kids struggle the most, I feel like. I mean, I've never done it before, but I feel like kids, it is scary, like having that oxygen like blowing into your face.
And it's loud and you can't talk. I mean, you can talk, but they can't hear you usually.
Right. So if anyone wants to try it, we'll practice and apply it.
Does anybody have any respiratory issues? I don't want to put it on them and then hear they have a hard time breathing when it's all said and done, so.
It's really not that bad, and it's
Yeah,
kind of
not
cool to
scary. It's
do.
kind of cool.
I'm gonna get a bigger towel because it's.
Thank you for watching our video. Please give us a thumbs up and hit the subscribe button, and all of our contact information, if you would like more information, will be in the description box below. Thank you.